You've got this personal, totally silent bodyguard working for you 24/7. It's constantly protecting you from a whole barrage of invisible threats. And that bodyguard? That's your immune system. It's this incredible marvel of biological engineering, basically our own private defense force. And this system is just so powerful. It can tell the difference between a friend and a foe with this breathtaking precision. But here's the catch. All that incredible power, it has a potential downside. Because sometimes, in its effort to protect us, the system, it can make a really big mistake. And that's the big question we're really diving into today. What happens when this guardian fails? We're going to look at the 3 tragic ways this can happen: when it overreacts, when it starts attacking itself, and when it just collapses entirely. Okay, so before we get into how it all goes wrong, we first have to understand how it's supposed to go right. Your immune system basically operates with 2 main branches. Think of them as 2 lines of defense. Let's stick with that army analogy for a second. It's like you've got 2 divisions. First up is your innate immunity. These are your frontline troops, right? Your skin, the acid in your stomach, all that stuff. They provide a really general, immediate defense against pretty much any invader. Then you've got the adaptive immunity. These guys are your special forces. They're highly specialized cells that actually learn to recognize specific enemies. And this is the cool part. They remember them, so they can launch a super targeted attack if that same enemy ever shows up again. So here's how they work together as a team. An infection shows up and bam, it hits the innate system first. If that's not enough to stop it, the adaptive system, our special forces, kicks into gear to finish the job. But really, the most important part is what happens next: immunologic memory. Those special forces now have a memory of that enemy, so if it ever dares to come back, the response is so fast and so powerful, you probably won't even feel sick. Mission accomplished, right? That's a perfect run. But what happens when the system's threat assessment is just completely wrong? This brings us to our very first malfunction: an exaggerated, totally over-the-top reaction to something that's, completely harmless. I mean, have you ever wondered why a little bit of pollen can cause so much absolute chaos? You know the feeling, right? The runny nose, the itchy eyes, the sneezing, and it's all because of a few tiny, totally harmless little grains floating in the air. That's your immune system basically sounding a 5-alarm fire for a threat that just isn't there. So the official term for this is hypersensitivity. And what's really happening is that your body sees a totally harmless substance, what we call an allergen, and mistakes it for a dangerous invader. After that first exposure, your body gets sensitized. And then every single time you're exposed again, it just launches a full-blown and frankly completely unnecessary attack. Okay, let's take a look at the actual battle plan here. The antigen, let's say it's pollen, it links up with a special type of immune cell called a mast cell. And you can pretty much think of a mast cell as a tiny little landmine. Because once that connection is made, it triggers the cell to basically explode, releasing a chemical called histamine. And it's that massive flood of histamine that causes all the chaos: the rashes, the trouble breathing, all the miserable symptoms of an allergic reaction. All right, so we've talked about overreaction. Now we're moving on to something even more tragic, and that's misidentification. This is when the guardian gets so confused about who it's supposed to be protecting that it starts launching an attack on the body itself. There's a quote from one of our sources that just captures the horror of this perfectly. It says, "The immune system seemingly reverses its function to one of self-destruction." Just think about that for a second. The very system that was designed to protect you is now actively working to tear you apart. And a classic example of this is rheumatoid arthritis, or RA for short. What happens here is that the body's normal antibodies, the proteins that are supposed to tag invaders for destruction, they get completely reprogrammed. They become autoantibodies, which literally means self-antibodies, and they start tagging the body's own healthy cells as the enemy. And they specifically go after the delicate lining of your joints. And the results? Well, they're absolutely devastating. You can see it right here in this X-ray. The immune cells just swarm the joints, causing this chronic inflammation that literally eats away at cartilage and bone. The crazy part is, this isn't some outside invader causing all this damage. This is friendly fire. And over time, this constant assault leads to some really severe, painful deformities. This diagram shows a couple of examples, like something called ulnar drift, where the fingers actually start to angle away from the thumb. And you can see other complex changes, like the swan neck deformity. It's just a really visible, painful reminder that the body is fighting a war against itself.
Okay, so our final malfunction is maybe the most frightening of all. What happens when the guardian itself is taken out? This is called immune deficiency. It's when the entire defense system is either compromised or fails completely.
So in this scenario, the body's ability to fight off any invader is critically weakened. And we're going to use one of the most well-known immunodeficiency disorders as our example here, HIV. What makes this virus so insidious is that it doesn't just sneak past the defenses. It goes right after the generals of the immune army itself. And its progression is just tragically systematic. First, you have stage 1, the acute infection, which often just feels like a bad flu. Then comes stage 2, the clinical latency period. The virus can go quiet for a decade or even more, but all the while it's slowly, silently chipping away at the immune system. And that eventually leads to stage 3, AIDS. This is the most severe phase, where the immune system is so damaged it just can't fight off other infections anymore. And this number right here, this is the critical threshold. A healthy person usually has between 500 and 1,600 of these CD4 cells per cubic millimeter of blood, and you can think of these cells as the field commanders of your immune system. Well, HIV specifically targets and destroys them. And when the virus drives that count down below 200, the army has effectively lost its leadership. That's when a diagnosis of AIDS is made. The defenses have collapsed, leaving the body vulnerable to what are called opportunistic infections, illnesses that a healthy person would normally fight off without even thinking about it. So there you have it. We've just walked through 3 totally different ways our internal guardian can fail. And each one really highlights the incredibly delicate balance that's required to keep our immune system healthy. So let's just recap the 3 tragic flaws we've talked about. First, you have the exaggerated response, like we see in allergies. Then there's the autoimmune response, where the system attacks itself, like in rheumatoid arthritis. And finally, the suppressed response, where the entire system pretty much fails, like we see with HIV and AIDS. So to put it simply, you've got overkill, friendly fire, and a complete system collapse. When you boil it all down, it's about information and regulation. That's it. Our health relies on this internal army knowing exactly when to fight, when to stand down, and, most importantly, who to protect. The line between being healthy and being sick really lies in this army's ability to make the right call every single second of every single day. It's this constant, high-stakes balancing act happening inside all of us right now as we speak.